Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Jennifer Gibson, the Coordinator of Community Education, Robyn Sinclair, the Systems Navigator, and Bobbi Williams, the Executive Director from Island Sexual Health Community Health Centre, which is located in Victoria, British Columbia. Bobbi is also the President of the British Columbian Association for Community Health Centres, which are our partners and we're big fans of. Through the Systems Navigation Access and Partnership Project, community health centers have been increasing efforts to improve health and social systems navigation access to strengthen Canada's healthcare landscape and eliminate health disparities while improving population health outcomes. How are you all doing today?
All good. Thanks, Hilary.
Awesome. So excited to have you all here and learn not only about the SNAP project, but about your community health center, as we've never been able to do any content before. So I'm super excited to have you all here today. Bobbi, I'll start with you. If you can give us the rundown, tell us about the community health center, the community that you're serving in Victoria, and some of the programs that you offer.
Yeah, absolutely. So Island Sexual Health Society has been around for over 40 years. And originally we were part of Planned Parenthood and then became an independent society in 1984. And we have always provided services around reproductive health care, both clinical on-site and outreach education in the community. And in 2019, we were invited to join in as a full service community health center with the Ministry of Health at that time. And that was under the new NDP government. So at that time, in addition to episodic sexual health care, we began to attach patients to primary care providers to provide longitudinal care. And the patients that we attached many were actually part of our sexual health services. So they were seeking episodic care here for STI testing, pregnancy testing, birth control, anything reproductive health care related. So from that group, we were able to identify patients, especially those who are looking at gender affirming care, and attach them to our physicians here at Island Sexual Health.
That's wonderful. Thank you so much. So Jen, if you could tell us, your community health center is obviously a safe place for so many people, regardless of gender identity, sexual orientation, or beliefs. Can you speak to the increasing importance of these safe spaces?
Yeah, absolutely. I think, one of the things that we have always committed ourselves to do is to be a safe and welcoming space for people, particularly about a topic that is incredibly personal, is incredibly sensitive. When we talk about sexuality, it is probably one of the most personal things that we carry with us and that evolves and changes, not only for ourselves personally, but, with a society. And so for ourselves, it's really important to make services available to all people in the most equitable way. And we know, especially when we talk about gender and orientation diverse folks, people who, have differing abilities, and they're living with disability, often one of the things that they really face barriers to is health care around health and education around their sexuality, even in terms of just being recognized and affirmed in that. And so for us, it's really important that we create spaces that people can access and not only feel welcome, but also feel a sense of power and an autonomy in. And that happens whether we're talking about educating in classrooms, where we're creating spaces for all people to be, whether it's happening within our clinics or whether we're doing outreach events, whether it's on our website. We're always trying to communicate the importance of diversity and the recognition that diversity is really what makes us such a, I think, strong, empathic and related community, and how we can take divisions and separations and isolation and really create connection. And when we're connected, we're going to be healthier.
Oh, I love that. That's so wonderful. And you mentioned, how you're sharing this information and resources. And I noticed not only do you have a beautiful website, that there was lots of resources available online. So, Jen, I'm curious why that increased importance of having those available even online and not just the in-person outreach.
Yeah, absolutely. Well, I think, welcome to 2024. I think our first stop when we look for information is online. And I think, when we then add another layer of really sensitive personal topics like sexuality and sexual well-being, of course, we're going to look online for that information. And so it's really important for us that we have a presence that is welcome and comfortable, but also really plentiful. And so I really appreciate the fact that you said that like it's beautiful and full. We do a lot of work, and actually we probably have one of the largest websites. We have a lot of pages on there with a lot of information because we know people are coming to this at different stages in their lives with different needs. And one of the things I was teaching grade 10 this morning, and I was talking to them about defining healthy and positive sexuality for themselves at this stage in their life. And then I asked them to, kind of jump ahead, teleport to the future, and define that for them as seniors. And they were like, well, we haven't had that life experience. We aren't able to do that yet. And so that's such a good example of how our needs are going to change. And our community healthcare really needs to meet people where they're at in which ways that is. And so I think online is really the starting place for people, but it's also the place where people can go back to when their needs change, and they can make sure that as a community healthcare center, education, it's not just about seeing our providers, it's about making sure we're really well educated, and also our families are really well educated, and the people we're living with and partnering with. So it really serves everybody, I think, not only as like a starting place to be, but hopefully as, a tool that accompanies you through your life.
Absolutely. And I'm curious, this is a bit off script, but can you extrapolate a little bit about the partnership with the schools? Because I don't know how common that is. I grew up in New Brunswick, and that is extremely not common. We also are only just starting to have community health centers. The model is very popular here in Ontario, but from what I've heard of schools here, it's still very much like guidance counselor might have condoms. Sexual health is maybe still a bit archaically spoken of. So I find this very like innovative.
Yes, it's pretty progressive, I mean, of course we have partners across Canada, like we work with Action Canada, and that used to be Planned Parenthood of Canada, and we work with folks in New Brunswick, and all in different provinces. And I think that we've worked really hard in BC, and we've been very well supported by other partners in schools, like you mentioned, and other community healthcare partners, to make sure that education is a priority about sexuality and that it's accessible to people, and that we do it in a way that's going to honor people with their values and their beliefs, and that it's really about providing evidence-based science information that people can take and pair with their values and beliefs to help them make choices to keep themselves like healthy and well. And so with us at Island Sexual Health, we've been able to, in the past more than 40 years, really cultivate relationships with our school partners, to build communication and trust, and to really become partners in providing information to people so that they can make decisions about themselves and their lives and their relationships as they shift and change. So our program focuses in grade 4 through grade 10, because that's where of course in BC, our provincial Ministry of Education and Childcare learning outcomes fit. So each grade will have a different learning outcome that they need to achieve. So like I mentioned earlier with my grade 10s today, the focus is on healthy sexual decision making. And so there's many things that factor into that. We're going to talk about identity. We're going to talk about orientation. We're going to talk about bleed control, birth control, STIs. We're going to talk about consent and respect. So it is a multifaceted approach. And then it's not only like the benefit, and I think the amazing part of our organization, like other community health care centers, is that this is a wraparound approach to health and wellness. So we're going into the classes and we're providing information, but if folks need to follow up with us for their own care, they can come to us as a community healthcare center, and we can provide them that non-judgmental, confidential information that's going to affirm them and hopefully meet them at where they are in their lives, and hopefully we'll travel along with them as they grow and change.
That is so cool. That is like that. I'm so impressed, and I only hope that the rest of the country could adopt more programs like that, because I can definitely see the benefit from personal experiences, knowing teachers, et cetera. But I almost on the flip side of that, I would say where you're seeing an increase in pushback, though, against trans care, gender affirming supports, access to HIV and AIDS, self-testing kits, and other supports to marginalized communities around sexual health and safety. How do you navigate serving communities in these difficult times? Which, I mean, you're clearly doing exceptionally well at serving them, but I'm curious how you navigate this difficulty.
Yeah, I mean, I think if we look at like politically where we're at right now, I think there's a lot of sort of siloing. There's a lot of kind of thinking that you either support this or you support that in many different ways, but especially around things like diversity and gender identity and orientation. And I think one of the things to realize is that our understandings of this are emerging, and they're moving out of understandings that were very limited and very narrow and very isolating. And so when we have these conversations, some folks feel like these are new conversations. This is maybe a phenomenon. When in fact, when we look back in history, there's always been gender and orientation diverse people, but we haven't created safe spaces for people to be who they are. And especially with healthcare, we haven't asked questions about who are you so we can provide you health. We've made assumptions. And what's happened is we've neglected and we've barriered people, further from getting the healthcare that they not only need, but that they deserve, that it is our human right to be who we are and to be treated with safety and dignity and respect and equity. And so I think the pushback, I tend to be an optimist. I think, like Bobbi and Robyn, and I think anyone, you know this, Hillary, from working in community healthcare, I think we're optimists. We look for the good and we try and support the good. And so I think in times of great change comes great resistance. And I think our antidote to that great resistance is curiosity. Let's come from a place of curiosity. Let's come from a place of respect. Let's talk about our values and beliefs. And yes, there's difference, but where can we meet in that middle so that people truly get the care that they ultimately deserve? It is always about making sure that people get the care and the education that they deserve. And so I think it's about just creating spaces where people feel safe and honored. And like, I can speak to my work in the classroom. I have students from all over coming to these sessions, and my job isn't to change their values and beliefs. It's not my job nor my right. It is my job and my role to provide evidence-based science information and information that they may then take and go, I hadn't thought about it that way, or maybe I understand this a little bit differently, and then I can be empathic, and then I can support people in whatever way they need to be supported to be healthier.
Absolutely. Thank you. So Jennifer had to run and go do the good work that you're doing. So I just want to give a second to say thank you so much to her for being able to squeeze us in your busy schedules. Robyn, I'm so excited to hear from you next because we're finally going to talk about the SNAP project, which I believe is well underway. So can you talk through what your SNAP project was that you were able to do with our funding and what you've been able to achieve so far?
Yeah, absolutely. It's been a real pleasure to participate in the SNAP community of practice. Island Sexual Health's intention with the SNAP project was to develop resources to support the work being done by members of our allied health team. So that includes supporting patients in accessing resources, including streams of income assistance and other community programming. So that really started with the development of the Community Resources Directory. So that's a living interactive resource document that's hosted on the Island Sexual Health website, where community members and service providers can access information about local resources, and it's categorized by different needs. So you can go on the Community Resources Directory and sort by housing or food security, for example. We then developed a number of systems navigation toolkits to provide accessible, easy to understand instructions on common benefits applications. So that includes provincial income assistance, for example, and federal programs like employment insurance. So creating our own toolkits was a really amazing project to be a part of because it meant that we could include community agencies that are locally relevant to our patient population. So for example, this is where you can go to access one-on-one support with disability benefits applications. So what we've observed throughout this process is that it's been really difficult for folks, including, members of our patient population and members of our team, to access up-to-date, relevant, accessible information about all of these resources online. They're often scattered across different websites or not updated, so you can't find current information. So our hope is that we can continue to keep our internal resources up to date so that they can serve our patient population for years to come. And the SNAP project also presented a really amazing opportunity to identify some gaps in our service delivery and some future directions for our organization. So first, we identified the need to bring patient voices into our decision-making in a more tangible way through the development of a patient advisory council. So this project is still in development. We're in early stages, but the SNAP project allowed us to do some of that foundational research and assess what we need to make that project happen in a sustainable way. And then after that, we identified the need to amplify youth voices, which really goes hand in hand with our interest in a patient advisory council. We're starting to talk about ways that we can maybe have a youth action committee, for example, to start to amplify those youth voices. So our first step was to put out a survey of youth's perspectives on education, access, and attitudes relating to birth and bleed control following the new provincial policy to have birth and bleed control free to anyone enrolled in BC Medical Services Plan. And we're still working to gather that data into a comprehensive report, but it really gives us a great starting point on gathering, youth's perspectives and starting to figure out how we can put that information out to decision makers. And it gives us some direction for the future, which is really exciting.
That's amazing. Wow, you were able to accomplish quite a lot. Like that's so wonderful. I am curious. It sounds like you named maybe some of the challenges in terms of, combing websites and trying to find, all things that are reliable or up to date in terms of data and these resources to share. But were there any other challenges that you experienced maybe while trying to set up and implement your new navigation tools, and how were they addressed?
Yeah, I mean, the biggest challenge personally was just time. So time to really sit down and do that research. But I think what's significant about that is that it shines light on how much work folks have to do to find resources that are relevant to them. So when you think about it, all of that individual research time for folks who are facing multiple barriers, it's really preventative for folks accessing the care that they need. So it's been really beautiful to put this project together and to hear from patients that we're working with or from other community service providers that these resources are helping them do that amazing work.
Amazing. And I was going to give you a chance to highlight any other successes as well, in case there is anything else other than, being able to see people get the resources that they need.
Yeah, I think it's also an amazing resource for learning. We have a number of practicum students that come into our agency every term, and having those toolkits available about how to access government resources, for example, is really valuable for our social work students or child and youth care students who come in, because those are documents and applications that they'll be supporting others with throughout their careers. So to have that as a training resource has also been amazing. It's really a lot of that background foundational work that helps our agency going and make sure that our workers can get out in the community. And I did the work of typing on the computer so that they can go out and do that work with our patient population.
Amazing. Well, good work with all the typing. I am curious. It does sound to me like you're still underway, but that there might be plans to hopefully sustain the work and the project moving forward.
Yeah, we're kind of at the point of wrapping up and putting those documents out to the community. So our community resource directory has been out for several months now, but those toolkits will be published on our website shortly for community members to access. So we'll be using them internally, but we want to make sure that they're available to other service providers in our community if they can make use of them. And updating those documents is a project that I think can be conducted by our practicum students. It's a really great opportunity for further learning and research for them.
Absolutely, that's amazing. And now, Bobbi, pivoting to you is one of my final question, which is always my favorite question to ask, and I do ask this at every podcast. What would increased investment, either federal or provincial, allow for your community health center to achieve, and how, also in tandem, would it potentially impact the SNAP project you were able to conduct?
Well, we've been very fortunate in BC with the introduction of and the building of community health centers and the development over the last, 4 years. We were one of the first ones that we were an organization that was enhanced. So we already existed to offer services, but we were enhanced by the new NDP government at the time to look at becoming that full service CHC. And what that also meant for us was funding stability, which we hadn't had for many, many years. And there were so many times we thought we're going to have to shut down the doors, because we simply can't exist on the previous model that we had in place. So the growth in BC over the last 4 years, and I see this not only as leading a community health center, but also as sitting on the CACHC board and seeing that process that happened over these last 4 years and what's been involved. The growth has been absolutely tremendous. I think we started out with maybe 4 or 5 CHCs, and now we're over 30. So we have seen exponential growth, but there's always growing pains in putting these, developing CHCs, building the resources, trying to navigate the tough times right now, and everyone in Canada is struggling trying to get their medical resources, their clinicians, family practitioners, nurse practitioners. So there's been lots of challenges, and I think that the commitment to the growth of community health centers in this province is great. And it was absolutely the right move, because we've seen the impact, even just our day-to-day activities, seeing the impact on our clients and how much better their health is overall due to the fact that they have the resources of a community health center. But there's still a lot more work to be done. And I mean, that's the case, I think, everywhere. I feel lucky to be in a province where this first step has been taken, but there needs to be that additional commitment, not just to the medical care of our patients, but the overall addressing social determinants of health, ensuring they have access to mental health support and other allied health resources. And that can be the sticking point. It's one thing to attach patients and have people connected to a family physician or a nurse practitioner, but the other big piece is increasing the development of those allied health resources, which are a huge part of what a community health center does. So hopefully governments will continue to see that as a priority, and will devote the time and the energy to seeing how much of a difference this model can make in people's lives.
It can make a huge difference, absolutely. And I mean, your community health center and is doing it's such amazing work. I'm so thoroughly impressed, and really excited for what's going on in BC. And I do hope that continued support and increase in investment does happen so that you can continue to do the amazing work that you're doing. Bobbi and Robyn, I want to thank you both so much. And I want to thank Jennifer as well for taking the time to speak with us today and tell us more about the SNAP project and everything that you're able to do over in Victoria. Robyn, I will ask you if anybody who is enthused by this podcast episode would like to learn more about the amazing work and take what I'm saying and build this somewhere else, or potentially reach out to you, where online would they be able to go to learn more?
Yeah, thank you, Hillary. The best place to go to learn more about Island Sexual Health is our website. So that's just islandsexualhealth.org. We have a variety of resources, including our sexual health library, and all of our documents produced by the SNAP project will be included on our website as well. We also have social media accounts, so you can find us at iSexualHealth on Instagram, Facebook, and X.
Yes, they finally decided to take down twitter.com. So it is now just X. Great. Thank you for being very up to date on that. And like I said, the website is really, really stunning and very robust. I felt like I was learning stuff over here in a different part of the country. So I hope no matter where anyone is listening to this episode that they go and check it out, because you're doing wonderful work. Again, thank you both so much for being on Community Matters.
Thanks so much, Hillary. Our pleasure. Thanks for having us.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.